When we look to our fiscal future, high growth in healthcare costs look to be the main game. So what can we do to solve it? One of the most influential pieces of research previously had been something called the Dartmouth Atlas of Healthcare. And what they'd found is enormous variation in the costs of healthcare across the United States. They found huge variation in costs, but almost no variation in outcomes. Well, from that they inferred that there must be very different practice styles. There's inefficient and expensive in some states, and relatively efficient and low cost in other states. And if we can just make the high cost states more like the low cost states, we'll manage to solve the problem of healthcare cost growth. We'll be able to bring it back down, which will have huge budget implications. Now, there's a very subtle methodological issue that this paper gets at. This is a paper by Louise Shiner, whereas the Dartmouth people had said, how much are we spending once we account for the different characteristics of the person we're spending it on? And Louise says instead, how much are we spending if we take account of the different characteristics of the state or the broader community within which that person's embedded? And when you make that very small change and you account for the differences in health status across entire states rather than across entire individuals, it turns out what the Dartmouth folks had thought were huge differences between high and low cost states largely disappear. So it's not that there aren't inefficient healthcare practices out there. There probably are. But Louise's point is that the major piece of evidence that they were out there, which is that some states were high cost and some states were low cost, may in fact tell us simply that some states have populations that require high cost treatments, others have populations that require low cost treatments, and it doesn't really tell us much about how much we could save money by implementing more efficient practices. So I expect this paper to be extremely controversial. It's overturning a conventional wisdom that was a key part of the healthcare debates in the United States, but I also expect it to be influential because it's a different way of looking at it, but really quite a convincing way of looking at the evidence.